Welcome to our show Health and Wellness, Myths and Facts. I'm Ambika Singh Kama. A few weeks back, it seemed that the COVID pandemic was in its last stages and we were hopeful that it will end soon. But the emergence of Omicron has thrown all our projections of 2022 into disarray. Even though we have a variant which causes a mild infection, it can still affect the vulnerable and the unvaccinated population. Due to Omicron's high rate of transmission and danger to unvaccinated and people who have not received a booster dose, hospitalizations could rise in the coming months. People with chronic diseases should be more careful about the management of their conditions during this phase. The role of nutrition in chronic disease management is particularly crucial, as diet is a modifiable risk factor for most chronic conditions that exist either as single conditions or in more comorbid states. For most people with type 2 diabetes, weight loss also can make it easier to control blood glucose and offers a host of other health benefits. And proper diet is a major part of it. There are several myths around diabetes and heart disease diet. These can also unnecessarily make people avoid some foods that they can actually safely eat in moderation. Expert advice will help our viewers get the medically correct information and act accordingly. We have experts with us. Let me introduce them to you. We have with us Dr. Mitali Joshi, MBBS, MD Medicine, US AIM, CDiab, FCMT Netherlands, physician and diabetologist, Vitus Clinic, Mumbai. And we have with us Dr. Ram Chitlangia, MBBS, MD DM, Senior Consultant, Interventional Cardiologist, Jeevan Rekha Super Speciality Hospital, Jaipur. Thank you all so much, doctors, for joining us today. Dr. Joshi, I would like to start with you first. COVID-19 is evolving with various mutations and we are hearing about the various variants of this virus. Why is Omicron a variant of concern?
So we are presently in the middle of the third wave of the pandemic, and I have seen the coronavirus evolving and mutating every few months. Since the outbreak in 2019, India's overall tally of the coronavirus infection has been almost 3.90 crore people, of which almost 10,000 proven cases of Omicron have been reported. And these numbers are rising very sharply. Omicron is an extremely infectious variant of SARS-CoV-2. Its infection rate is much higher than the original COVID-19 virus. However, the symptoms of the disease are milder with fewer lung complications, possibly because the majority of the citizens are vaccinated. There has been a slight increase in the hospitalization rate recently though, and we are unsure if it is because of the Omicron virus or of the Delta variant. The next few weeks will reveal more information on the behavioral patterns of the various variants that we are seeing. But all the safety precautions to be taken by us remain the same regardless of the variant.
Absolutely. I think key here is to take all safety precautions and maintain COVID protocol. Dr. Chitlangia, the next question is a WhatsApp question from a viewer, A. Mathur from Delhi. She wants to know, I have recently recovered from COVID and I want to get a full health checkup done on all my vitals to ensure that there is no effect of the infection. What is the correct length of time to wait before I do so?
Basically, COVID is such an illness that will affect every system of the body, including the cardiovascular system, your blood system, your lungs, brain, and everywhere it can be affected. So once you have a mild COVID infection which does not involve lung extensively, probably after recovery from COVID or becoming RT-PCR negative, there we should give a window of 6 weeks to get a complete health checkup done or complete routine evaluation done. But if you have been suffering from a moderate or severe COVID, which has lung pneumonia or severe infection in lung, then probably it is better idea to give times for recovery for at least 12 weeks for lungs. And in between, your pulmonary physician or general physician should see what is the recovery of body. And after 12 weeks, you can get a routine evaluation done, including the cardiovascular system status. And all the blood tests as well as the treadmill and all the other tests can be done at least after 12 weeks. So 6 to 12 weeks is the ideal time after COVID recovery.
Okay, so 6 to 12 weeks. I hope that answers your question, Ms. Mathur. Dr. Joshi, why are complex carbohydrates good for people with diabetes? And how can we really incorporate complex carbs into a diabetic diet? And how can one also reduce the consumption of simple carbs? Because there's a lot of confusion on how much consumption and how can one really reduce it?
Okay, so first let us understand the differences between simple carbs and complex carbs.
Yes.
Simple carbohydrates are broken down very quickly by the body to be used as energy. They are found naturally in certain foods such as fruit, milk, and milk products. But they are found in larger quantities in processed foods and refined sugars such as candy, table sugar, jaggery, syrup, soft drinks. Complex carbohydrates take longer to digest and are a more stable source of energy than simple carbohydrates. Consuming complex carbohydrates helps us to avoid spikes in our blood sugar levels. Instead, instead of a peak, we see sustained blood glucose levels which do not peak. Some examples of complex carbohydrates are whole grains, traditional millets, brown rice, most of our vegetables, fruits such as apples, pears, kiwis, strawberries, etc. Diabetics need to reduce their intake of those carbohydrates which can cause these spikes in their blood glucose.
Okay.
So basically this includes soft drinks, desserts, processed snacks, deep fried food, chocolate, candy. Also, each person responds very differently to different food. So people must be encouraged to maintain food diaries and correspond their food to their sugar levels by checking their blood glucose levels at home after consuming these various types of food.
So actually, I think you've really put that well, that it can be, one has to really see what works for them, what suits them. I think that's a very important point out there, Dr. Joshi. Dr. Chitlangia, tell us that we all know that heart disease is the #1 killer worldwide. So if you're worried about heart disease, one of the most important things one can start to do is really to start eating a heart-healthy diet. So tell us, what foods should one always have on hand to promote a heart-healthy diet?
Undoubtedly, cardiovascular disorders are the leading cause of mortality across the world, and a healthy diet as well as a healthy lifestyle both are equally important to counter the heart disease as well as to reduce the mortality and morbidity from heart disease. One should take diet in a fashion that the energy consumption should be balanced by the total caloric intake. So total caloric intake should not be very much more than the energy consumption. To avoid the weight gain. So weight gain creates a lot of problems. Particularly regarding diet, we should avoid saturated fats which are present in red meats and the processed meat as well as the full fat dairy products. We should try to eliminate trans fats from our diets. Many of the packaged foods as well as biscuits, cookies, these do have hydrogenated fats like the vanaspati ghee and vegetable oils, which should be eliminated from our diet. We should try to increase soluble fiber intake in our diet, try to increase the intake of fruits, vegetables, whole grains, as well as low-fat dairy products. These all things can be done to maintain a healthy heart diet as well as to maintain the body weight in a particular proportion, which can help us fighting the heart diseases in a better way.
Okay, and these are quite doable, like eating a healthy diet, having fruits, having a lot of fluids, and of course giving up bad habits like one really needs to quit smoking as well as drinking. Dr. Joshi, again talking about diet, some people add honey to their coffee and tea or use it as, use a sweetener when they cook a dessert. Can people with diabetes really replace sugar with honey? Do you recommend that?
So we have a lot of information coming our way because of social media. There's a lot of bombarding of information.
Too much information.
If you have diabetes or if you're at a high risk for it, you might have heard a lot of claims about a lot of sweeteners. So it's not just honey, it could be jaggery, it could be cane sugar. So while these natural sugars like honey have some health benefits, they are still a large source of simple sugar and carbohydrates.
Okay.
Now, how is honey different? It is different from table sugar because refined sugar does not have any vitamins and minerals. Honey, however, has certain small quantities of vitamins, minerals, antioxidants, etc. Now, these quantities are very minute. Secondly, honey has a slightly lower glycemic index than sugar. What does glycemic index mean? It basically is an index to measure how quickly the blood sugar levels rise after consumption of carbohydrates. Now, honey has a glycemic index score of 58, while sugar has a glycemic index value of 60. So there's really not much difference between the values of honey and sugar.
Okay.
This basically means that honey, like all carbohydrates, raises sugar quickly. Maybe not quite as fast as sugar, still quickly enough. About the vitamins and minerals that are present in honey, the amounts of vitamins and minerals in honey are not significant. So we cannot look to honey as a major source of these nutrients. If you want to use honey as a source of nutrition, you'll need to use approximately 5 cups of honey at a time.
Okay.
There's not likely to be much of a benefit to swapping sugar for honey if you have diabetes. They affect your sugars in similar ways.
Okay. So you don't really recommend, I mean, it's not the best idea that one can have as much honey. So, I mean, it's quite similar. So that's what, I mean, I think that's a very important point, because a lot of people tend to think, oh, we can have honey because it is safer than sugar. But that's not true, right?
No, it's not.
Okay, thanks for explaining that really well. Dr. Chitlangia, high blood cholesterol levels are also a risk factor for heart disease. How are blood cholesterol and dietary cholesterol related, and what's the best way to reduce the amount of cholesterol in a diet? Because cholesterol is also something which a lot of people struggle with in today's day and age.
Basically, cholesterol is a waxy substance and it is inherently not bad for our body. It does help make us our cell membranes. It does help make us our vitamins as well as hormones in our body. And most of the body cholesterol is produced by the liver. So you can say around 75% of the blood cholesterol is produced by the liver, and around 25% of the blood cholesterol are taken by the dietary intake. If dietary intake of cholesterol is high, then it can increase the blood cholesterol level, and particularly if you take the amount of saturated fats as well as the trans fats, it can increase the bad cholesterol, which is the mostly the low density lipoprotein cholesterol, that is LDL cholesterol. Okay. So we should try to decrease these saturated fats, especially the coconut oil, palm oil, which are prevalent in some places. They should be avoided for as a cooking food. And trans fat and hydrogenated fats are also avoided to decrease our cholesterol level. Other than our diet, there are other things which we can use to decrease the cholesterol in our blood level, which are like increased physical activity, which can also be helpful. Decrease the amount of sugar intake in our diet, reduce the smoking or quit smoking, and reduce tobacco products. Yes. And to maintain our blood sugar also, as well as the diabetes level, which can help us in fighting the heart diseases as well as the decreasing the blood cholesterol level in a better way.
Okay, I think those are some important tips you've given. I mean, reducing saturated fats is again a very important point, and what you've really explained us about the good cholesterol and the bad cholesterol. So on that note, we're going to be taking a really short break. We'll be right back very soon. Welcome back. You're watching Health and Wellness, Myths versus Facts. Dr. Joshi, we have a WhatsApp question for a viewer. We don't have the name, but the question is a low-carb diet the only way to reduce diabetes medication or to control diabetes? And also, can we monitor the intake of carbohydrates by using certain kinds of apps?
A low-carb diet basically helps people with diabetes better manage their blood sugar levels. What are carbohydrates? They are those foodstuffs which raise blood glucose more than the other foodstuffs, meaning that the body must produce more insulin to counter them. Reducing carb intake can help stabilize blood glucose. It may also counteract some other effects of diabetes, such as weight gain and heart disease. Despite this, low-carb diets also carry certain risks, including vitamin and mineral deficiencies. So patients may complain of hair fall or their skin getting dull or tiredness. For some people, low-carb diets are challenging to stick to over time. Balance is the key. It is best to see a certified nutritionist to guide you on the path to low-carbohydrate eating. Also, we must bear in mind that these are not temporary diets. They are always going to be there. We are adopting them as healthier lifestyles for the long run. About the second part of the question, apps. Now today we have the help of technology to assist us in our journey towards better health. Using certain applications on our phone help us take note of our day-to-day activities, food consumption, calorie counting, sugar charting, blood pressure charting, etc. Some of these apps work using artificial intelligence, while certain apps are designed to tailor programs based on each person's individual needs. They have a dedicated back-end team of nutritionists or life coaches to guide and mentor a patient through their journey toward their health goals. I feel it is worthwhile for diabetics to explore this avenue and take the help of technology for better lifestyle management.
Okay, so I think that's well explained. It's important that we can use technology to our benefit. And what you rightly said is about balance is the key here. I think Dr. Joshi, not suddenly stop carbs and it will affect the body in some way, or like you said, hair fall. Dr. Chitlangia, another interesting question. We've read in many articles that dark chocolate and red wine are good for the heart. Is that really true? And if it is, how much quantity is healthy?
So there are a lot of myths regarding these dark chocolates and red wines. Dark chocolate, there are multiple types of chocolate like milk chocolate, white chocolate, dark chocolate. Dark chocolates contains more of cocoa powder, cocoa liquid, cocoa solids is more than the other type of chocolate. And these cocoa solids are supposed to have dietary flavonoids, which have been seen in some studies as to be protective for heart. But the other part of a story that in that dark chocolate you do have a lot of sugars also, which will have a significant calorie value also. So if you are enjoying dark chocolate, then you can take it. But to start dark chocolate, to keep your heart healthy, you will have to ingest that much amount of chocolate that the caloric value will be much more. So which can lead to weight gain. Similarly, the thing exists for red wine. It has been seen in some studies that red wine is protective for heart disease, or red wine decreases the risk of dying from heart disease because of presence of some antioxidants in red wine, and some resveratrol is there, which also decreases the risk of heart disease. But again, the amount of red wine you need to ingest to get a protection for your heart will be too much, and there is a risk of alcohol abuse also, which can have a significant deleterious effect on your body as well as other systems like liver, stomach, and all these things. So it is better, not advisable, not to start drinking for cardioprotective effect. But if you are drinking, then use it in moderation. So around 1 to 2 drinks per day for males and up to 1 drink per day for female is advisable by the US regulatory authorities, which is a safe amount of drinking. But you should never start drinking for the heart benefit, or never eat too much of chocolates to get the heart protective effects.
I think that's interesting the way you've put it. One shouldn't really start eating dark chocolate or start having wine just for the heart health, but of course in moderation, like you said, and you don't recommend dark chocolate as well, and wine of course in moderation, though it has antioxidants, what you were saying. Dr. Joshi, is unrefined natural sugar better than the granulated cane sugar that we normally buy?
Okay, so another myth that we keep getting from a lot of patients. So the terms natural and unrefined are often interpreted to mean unprocessed, which is why calling them unrefined is slightly misleading.
Okay.
No matter how natural the sugar is, it is still sugar and should be treated as such. Unrefined sugars are a little less processed, so they do retain some more minerals, some antioxidants, maybe some of the plant nutrients that are present in the soil that the sugarcane was grown in. But these nutrients are all removed during the more extensive refining process.
Okay.
Are these nutrients enough to justify consuming unprocessed sugar? Again, not. Sugar is sugar. When it comes to the debate over whether unrefined sugars and sweeteners are healthier than refined ones, please remember that honey, unrefined sugar, coconut sugar, they're all concentrated sources of sugar, just like normal table white sugar.
Okay.
And consuming too much sugar, no matter the form, can lead to health problems and worsening of diabetes. So no differences between cane sugar and refined sugar.
So sugar is sugar. It's either way you put it, it's not good for you. But of course, whether it's processed, unrefined, coconut sugar, like you really rightly put, it's sugar is sugar. So I think that's a very clear point out there. Dr. Chitlangia, what really is the role of cardiac rehabilitation after a cardiac procedure? Does cardiac rehabilitation improve the quality of life in such patients? And really, what is the role of diet in cardiac rehabilitation?
Cardiac rehabilitation program is a very important part of patient after any cardiac procedure or any cardiac event. It cannot change your past. Whatever happened with your heart, it cannot change that fact. But naturally, it can be a safety feature for your future heart health. The cardiac rehabilitation program is a medically supervised program, which can have 2 to 3 components. One of the most important component is the exercise schedule. Many of the patients are sedentary in lifestyle, and then they suffer some kind of heart attack or heart failure or arrhythmia. And then we tell them to have a supervised exercise program to start slow and then increase it gradually. We must emphasize that the safest part of exercise is the daily walking, and at least 30 minutes of walk should be promoted daily, at least 5 days a week. More than that, moderate intensity exercise can be done, but definitely 30 minutes a day is must. The second part is the adoption of a healthy lifestyle in terms of diet as well as in terms of other risk factors for heart disease like diabetes control, control of your blood pressure, decrease the salt intake, quit tobacco completely, be physically active, and decrease your body weight. So these part of the rehabilitation is also very important. And third, and one of the unrecognized or ignored part of rehabilitation is the mental rehabilitation. Many of the times patients are unable to accept this fact that they have suffered a heart attack at a young age or very early age, and that leads to depression in many patients. So that part should be taken care of properly, and we educate them properly as well as counsel them regarding the future life. And it is not the end of the life. You should try to build the psyche and include yoga and meditation in the cardiac rehabilitation program for a better and successful rehabilitation and a longer life regarding the cardiac health.
So cardiac rehabilitation can really help a person in every way. I mean, like you rightly said, I think mental health is also something which is looked into that angle, not only the physical aspect. So thank you so much, Dr. Joshi and Dr. Chitlangia, for sharing all this with us. I think we've learned a lot today, and especially some important tips like whether it's sugar is sugar and maybe not having too much of dark chocolate and wine as well. So thank you all so much for joining us.